Good morning, everyone. Good morning. Jambo. You need to learn some Swahili this week. Yeah? Well, it's good to see all the beautiful faces, people that I haven't seen in a while. So please welcome to Nairobi, and I hope that we'll have enough time and plenty of time to interact outside this room as well. I think as Fred has mentioned, we're really happy and honored that most of you actually took your time out to be here on a Sunday morning. Some of you had to probably leave behind family, Thanksgiving and many other celebrations behind. So we're extremely grateful that, that you've prioritized your time here with us, travel all the way to Nairobi, and we hope that each one of you will get exactly what you came looking for. So as Fred mentioned, we've got a packed day, 3 days actually, including today coming up. And we hope that these 3 days will enable us to interact really deeply. And all of us will be able to get something of what we hope to get out of this meeting. So just to mention, so far we've got 41 countries represented from the registrations we have. We've got 102 organizations, 37 sessions, and so far we've got 318 participants. A round of applause. This is significant in a lot of ways. The Open Digital Health Summit, this is the inaugural Open Digital Health Summit. For those of you who don't know, this just came off through conversations that started off a couple of months ago, really around the notion and the concept of full stack, which you'll get to hear a lot over the next couple of days. And the idea and the suggestions were, what can we do together? Because most of you are traveling to come for the Global Digital Health Forum. So really happy and proud that this has come together well. And we do look forward to starting off this movement, which we hope that is going to be more than a one-off occurrence. So the idea is that hopefully this will build up into a momentum. The full stack and the foundational components that define full stack are just the beginning of this conversation. And we hope that over time, this will gel into a global community and a global movement as well. I think for me at a personal level, today is symbolic in a lot of ways, also because we are celebrating the World AIDS Day. And I think majority of us in the room here probably started our careers in digital health in the HIV programs. I certainly did. So I remember my early days working in Kenya for the University of Washington and supporting Ministry of Health was building the Kenya EMR. Kenya EMR was, and we're still trying to shake off that tag that was HIV EMR, was basically funded by the HIV program through the gracious support of PEPFAR program. And we built that over the years, and I'm sure many of you can also associate your early days in digital health to programs like the HIV program. So it's really significant in a lot of ways that as we're celebrating the conquest that the world has made over the AIDS pandemic, that we're here starting off a global movement on digital health that will hopefully be a really significant intervention in the global health agenda that we are all really committed to working through. So I don't want to speak too much. Tomorrow we'll have the official opening by the government of Kenya. We're very privileged that we'll have the ministers representing the Ministry of Health and Ministry of ICT. Extremely privileged to have their presence tomorrow. So we'll save the official opening for tomorrow. But today we are also very privileged to have with us the Director for Digital Health, Health Financing, Policy and Research from the Ministry of Health, Dr. Manya, who I would request that he comes and welcomes you as well on behalf of the Ministry of Health. Dr. Manya?
Good morning, ladies and gentlemen. Today we are privileged to be in session, so I don't need to say good morning, good afternoon, wherever you are. All of us are in the morning session, and I'm glad to welcome you. I just want to say that at the moment, the government of Kenya is really supporting digitization of all the records, including e-government. If you want your national identity card, everything is being done digitally. And also on the health aspect, we are pushing towards the digitization of health records. This is a very big job, and we hope we'll be able to succeed. Just to say that the importance of such a forum, they create a chance for us to cross-fertilize ideas from other areas to see what they are doing so that we can pick these ideas to improve our own country's perspective and also come out and improve even the neighbors. So we take this meeting very seriously because we'll create ideas that will support us. I've always been joking with people that in as much as we are scared of the digital way, including the AI and what AI might do to us, maybe kill us all, we still have to move and see the best out of the digital world. So I just take this opportunity to welcome you. You'll get the real speech from tomorrow. And just on a personal note, when I was young, I really dreamt of going to South Africa. And when the opportunity came, we went there at night and left there at night. I hope it won't happen to you. You should also be able to see a bit of Kenya so that you just don't come and rush without seeing a bit of Kenya. So take time to walk around and see the people. You will not discover the people all in 1 minute, but at least you'll see the ambience, the friendliness, and the beauty. Thank you, and have a good deliberation.
All right. What an exciting morning. So good morning, everyone. Excellencies, distinguished guests, friends. As folks have already said, this is such an amazing gathering. 300 people, 50 countries. Who would have thought that something as exciting as interoperability and infrastructure would be the glue that brings us all together here? So, nawakaribisha nyote and nafurahia kuwa hapa, which means welcome and I'm happy to be here. I'm sure I massacred that. Next year, AI will do it for me, so it'll be easy. So it's really a milestone moment for us in digital health as we gather here in Nairobi, coming to learn from each other, to be inspired by each other, to leave this hall with the excitement and the enthusiasm around these topics that we discuss. As we move our health systems from the analog to the digital, this is a journey that is full of potholes and obstacles and road bumps. But if there is one group in the world that can come together and address these challenges in ways that are constructive, creative, and rooted deeply in the realities out there on the ground, not clouded by illusions and hype, it's this one. So it's really exciting to have you guys coming together. I want to recognize and really thank profoundly our friends at the Kenya Health Informatics Association, at Helena, and our esteemed host at the Kenya government, as well as all the partners who helped to organize, resource, and support this meeting. So to all of you, I say, Asante Sana. There was a global family that had to come together, and many of them are unsung heroes that worked day and night for months so that we could come together and have this important conversation. And although many of us may be technologists, informaticians, programmers, policymakers, what brings us here today is a singular thing, and that is a commitment to infrastructural thinking. And this is really significant because the roads, the highways, the plumbing of today's world that is going to change how we do the mission of public health is digital. And so when you think about it, each one of us carries in our pockets a tiny miracle that to someone born 100 years ago would be an impossibility, right? This device that lets us look up information, that lets us connect to people around the globe, or on the whim of a moment, look up videos of cats and baby hippos. This is possible only due to the magic of connectivity. And connectivity is dependent on shared infrastructure, whether it's electricity, cellular networks, and standards that allow data packets to travel from the 50 countries that you represent to be here in Nairobi today. Many of you have used your credit cards to pay for goods and services, to pay for your hotel. That too is a privilege that's afforded to the backbone of that shared infrastructure that we enjoy around the globe. And so this ability to cross borders, this ability to use our health records across jurisdictions is thanks to the power that digital public infrastructure can unlock. So a meeting like this doesn't just happen out of the blue. The planning for this meeting began over a year ago with the first meeting in Kigali, in Rwanda, where a smaller number of countries, technical experts, and government representatives came together to start to build this global momentum around digital public infrastructure and fast health interoperability resources, or FHIR. And if those are two words you don't leave 3 days from now with in the back of your head and on the tip of your tongue, then we would not have accomplished the mission. 3 years ago, we began working with our colleagues at Google and across the technology landscape to bridge these important ecosystems of policymakers with technology developers to try and address the problems and challenges that we face on the ground. So over the next few days together, we will learn a lot of things, and we will have the opportunity to share a lot of things. And for many, we recognize that some of the concepts that will be shared will be new. But there are others in the room who have been defining these terms by the work and leadership that they have been doing in the world in their daily lives. So I'm going to ask all of you to just be patient, because everyone's at a different level, right? So let's make sure that we're understanding that each one comes from a different background and a different set of circumstances. And what works in one place, whether it's the country of Lithuania or the country of Ethiopia, it's finding that common ground of shared problems, shared challenges, and potentially shared solutions. The thing I'd love for all of you to commit to, however, is not reinventing wheels. We've seen more than 20 years of wheel reinvention in this space. And what brings us here today is that commitment to not reinvent wheels, where we seek actively things that others have done that we can bring into our work and accelerate the goals that we're trying to achieve. So as this is the first meeting of its kind, and as Stephen just mentioned, something that we hope will go on for years to come as we congeal these ideas, refine these concepts, and make sure that you all have the tools that you need to accelerate digital transformation through this fundamental approach, I think we're also asking for your help, right? So think of yourselves a bit as guinea pigs that we're trying to use as your expertise to refine how we do future meetings like this. So as you think about ways that things could be improved, things could be clarified, please put those on a parking lot that we can bring to the organizers, and collectively, as we do these meetings around the world, we can get better and better in bringing this content to countries around the world. So we have a lot of things to discuss over the course of these next 3 days. But as I said earlier, these are the superstars of digital health and of government vision that have come together. So if we can't tackle these challenges, then I dare say there's few others on this planet who can possibly do that. But you're also people who are on the ground, and I want you to also challenge yourselves with pragmatic realities, right? Keep that healthy bit of skepticism that are we grounding the things that we talk about in the political, financial, and human realities in the context where we're trying to solve these problems. Many people outside of the world of digital suggest that sometimes we are over-enthusiastic, that we are somehow jaded by the shiny objectism of this space. And I think it's really critical that we bring that self-critical lens to these discussions. So when we think something is easy or relatively straightforward to implement in one context, we have to challenge ourselves to say, how is this translatable to another setting? Over the next 3 days, we'll be charting this path together. Later on, during lunch, you will be given a roadmap, a visual cue that will help guide us through this journey, where you'll be able to look at the concepts and pathways and think to yourself, these are things I understand, these are things that I'm not so clear about, and use that roadmap to touch base with colleagues around you to say, is this something that you guys have tried in your geography or your jurisdiction, and how has this worked? So we're trying to provide you the tools to help facilitate that process. As we work together, one of the things that we're really trying to do also is to stop building vertical disconnected silos. And it's really exciting to have so many partners from the development community here with us. Earlier, I was speaking to my colleague from USAID, who recently put out a very, very powerful position paper reinforcing as a development partner how these messages of infrastructure and shared services are critical to move from digital experiments to digital transformation. And so the idea of building commons that are useful to all, that are available as public services, that is what we're talking about today. A last word about infrastructure, because you're going to be hearing a lot about digital public infrastructure. And whether we're talking about a road or a water pipe, infrastructure by itself has little value. It's a road, it's a pipe. It's how you use that infrastructure to deliver services, to deliver economic opportunity that is the most exciting. And so when we talk about digital public infrastructure, we're not excited about the infrastructure, we're excited about the children who are going to get their vaccines on time in a complete series. We're excited about pregnant moms being able to seek timely antenatal services. And so tomorrow, when we put these theories into practice, we're going to be using the immunization use case as a template to ground truth and to pressure test the concepts and ideas that we discussed today. And so we're delighted to have our colleagues from UNICEF, from Gavi, who are here with us to actually give us those ground truthing walls to pressure test our concepts against. The last thing I'm going to ask you, that in the spirit of mindfulness, and we know this is a challenge because there's a big world out there with many colleagues and a lot of emails that are being queued up as we sequester ourselves in this beautiful place in Nairobi. But I'm going to ask you to try as much as possible to be here. Be in the moment, be present, and be participatory in the conversations that you're having. Because otherwise, that's a big carbon footprint for many of us that doesn't bring the return on the investment and the cost of coming here together. So we understand, of course, that there's going to be those distractions, but do try to compartmentalize and be here and listen, learn, and share what you have come here to communicate to others. So I am so excited to get started with all of these discussions. There's so many exciting people out here, and just already, just in the few minutes that we've had in the morning, I think I've met 12 people who I'm looking forward to sitting down and digging deeply with. But we couldn't be more thankful for your presence, and we're delighted you're here. Welcome, and let's get the show on the road. Thank you so much.